So now we have our next session, which is social and emotional support when coping with kidney disease. And so I'll introduce you to Lara Tushla. Lara was semi randomly assigned to a nephrology clinic for her master's in social work program internship. Long before the days of Google, the dictionary only told her that nephrology had something to do with kidneys. It ended up being the perfect place for her. And she worked in a dialysis clinic for 6 years, now has been the kidney and pancreas transplant social worker at Rush University Medical Center for the last 23 years. I'll say it sounds like nephrology was a perfect fit. Welcome, Laura.
Um, it turns out that I was part of the group that planned the original Living with Transplant workshops that the National Kidney Foundation did uh, a long time ago, and was having dinner with Ron D. Whitman last night, and looked back through my records. The last time I did a talk, or the first time actually, I did a talk for Living with Transplant, which is how it was titled at that point, was in 2001. So Living with Transplant and incorporating kidney disease has been around for a very long time now. And so I appreciate KFI inviting me to speak on my 20-year anniversary of speaking for this group. With a relatively short amount of time, I wanted to focus this a little bit and talk more about connections, social connections within the time of distancing. That has been our last year plus with COVID. It's kind of typical at the beginning of a presentation for people to talk about their disclosures. And so my disclosure for you all is that I am not necessarily an expert. We've all had a lot to learn in the last year plus on how to remain connected in different ways than we have been before. So I consider you all to be as much an expert as I am in how we navigated this last year and what we take forward with us. The human species, we have been, we were born, we were designed to be interconnected. There are some animal species that really don't need much interaction with others of their same sort, and that is not who we are. A lot of when we're meeting new people is we're trying to figure out what do we have in common, what are our connections. Connections come in a lot of different forms. You think most commonly or quickly about family and friends. That was supposed to be family and friends, not family and family, but immediate and extended. But connections are also through neighborhoods, through schools, through work, healthcare settings as a patient or caregiver, community clubs, religious communities. There are a lot of things that when we're that help us find other folks that are going through similar things as ourselves. There has been research over the years looking at the benefits of physical connections, of face-to-face, close proximity connections with people. They have found that some of the benefits include being more resilient to stressful situations. So, sort of ironically, in this time when we have not been able to be physically close to many people, that actually is one of the benefits to face-to-face is being able to navigate more stressful situations. People that have more face-to-face interactions with others report decreased pain, increased energy levels, higher levels of mental sharpness, physical, mental strength, and kind of having an overall sense of safety and well-being by being connected. On the flip side, we see that there are risks to social isolation. Um, Studies have shown that long-term isolation leads to higher, longer-term levels of the fight or flight stress response, increased levels of stress, and decreased quality sleep. People who are more socially isolated are at higher risk of dementia, depression, anxiety. Studies have actually shown that the immune system of people who are socially isolated tends to be weaker. And as I will speak for myself here, as many people have maybe noted in the year of social isolation, is uh, decreased levels of motivation. I will own that one. There's need for being distanced from people due to COVID has a lot of really important science-based rationale. So being more than 6 feet apart, wearing a mask, not hugging, shaking hands, not being in large groups, all of that has been very important to our physical health, has helped in decreasing the spread of COVID over the last year plus here. But there are negatives to it. And I think it's going to take 20 or 30 years, maybe longer, before we really know all of the effects that this year plus of quarantine pandemic we've dealt with is. It'll take some time to really know how it's affected our physical and mental health, our economy, our children's education. So there's a lot that we don't know yet about the impacts. There was a survey done because this topic is focused more on the mental health piece. This survey looked at some of the mental health screeners factors that you look at, and the during this of the respondents of the survey, 41% noted that they had symptoms of anxiety or depression. This article I read didn't specify whether these were new diagnoses or symptom recognition or somebody that has dealt with this before and had a strong reaction in the current times. They also were looking at substance use. 13% of respondents said that they had new or increased levels of substance use related to COVID stress. And along with that, there has been increased rates of drug overdoses. And the U.S. and of this group, 1% that they had thoughts of suicide in the last 30 days. So this is a significant impact on our society that is found relatively newly in our system, and we'll know more about it as time goes by. One of the things that is challenging in our society is that we use terms like depression and anxiety to address a lot of different conditions and concerns. So it can be anything from I'm having a bad moment, a bad day, or I can't get out of bed and do what I have to do. Or I feel like I'm having a heart attack from an anxiety attack. So it's a large range of conditions or symptoms that can go with or under the terminology of depression or anxiety. And all of us have different ways of handling stress in our lives, depression, anxiety. We have coping mechanisms that we've developed for ourselves. Talking with friends, and exercising, meditating, prayer, hobbies, movies, going out to dinner. Not all of our coping mechanisms are healthy. Like there are stress makers or eaters, sort of following after our dietitian experts before us. There are they're not always healthy, but we have different ways of dealing with things. And COVID has made some of these much harder or harder to access or use in a way that feels as helpful as it has in the past. Like talking with friends on the phone sometimes doesn't quite provide the same level of support as in person. So if you get to, when people get to a point where they need a little extra support than what their usual coping techniques are doing, sometimes it's time to reach out and for counseling, therapy, and to provide a little additional support, or sometimes a lot of additional support, depending on what you're needing. Sometimes it's hard to figure out where to start. And so I have listed here on the screen a variety of places where you can get suggestions. The team in dialysis or transplant, they may be able to provide some counseling in-house, or definitely help you get connected, just like your primary care doctor would also probably have some access to resources. The Kidney Foundation of Illinois would be able to help connect folks, and so does employee assistance programs can be incredibly helpful, because a lot of times you can get a few sessions with them through that system before using your insurance. And insurance companies have their own referral networks that they use. One of the places I look when people are asking me for recommendations are hospital-based clinics. So, looking at the hospital that's closest to you, calling them and asking if they have counselors, mental health clinic, and recommendations from friends and family religious leaders. On the bottom of this page, I have a couple of websites. Psychology Today tends to be able to connect you to individual counselors, maybe that are in private practice or small groups. The treatment at SAMHSA tends to connect more to clinics, and they also have connections with if substance use is something either you would like to address in addition to mental health or specifically substance use, you can search through those things. The Illinois Department of Public Health, in the beginning of COVID, created this resource, this call for calm. And they have where you can, if you text the word talk, or Lara if you prefer Spanish, to 552020, you'll get a call back within a day, 24 hours, with a local mental health provider. As an aside, you can also text food, shelter, unemployment. They can help connect with other community resources if that's something that you would need assistance with or guidance with. Obviously, you can talk to the dialysis and transplant teams, but this is another resource. One of the things that I think is was a disservice, I think, at the beginning of the COVID era is the talk about social distancing. That became the buzzword. In reality, it should be social distancing. What the infectious disease experts and epidemiologist experts were wanting us to do, and are still wanting us to do, is to kind of stay away from people. So be more than 6 feet apart, wear a mask, don't hug, some don't have a lot of physical contact, don't be in large groups. They're talking about the physical distance. The social distancing, as we kind of talked earlier, the social part is what we need, whether we're physically close or not. And in this era, we have had to come up with lots of different ways to stay connected. And I would say if people have things that they have done that have been particularly helpful for them in the last year plus, if you put those in the chat, I bet other people would enjoy hearing what techniques you use. So, the phone, video calls, social media, online classes and resources and game nights. I listed, the most common or popular ones are the Zoom, like we're doing now, and Google Hangouts and Skype, and lots of education support classes are available. Then you go old school email, and then you go old school with the postcards and letters. In the beginning of the pandemic, I wrote a lot of letters to folks I haven't done in a while. There is a whole set of resources out there online where they can help you figure out how to do online games. I'm sure I'm going to pronounce them incorrectly. The Hessen Academy folks put together this resource for virtual family reunions. So they have ideas on how to do games remotely and scavenger hunts and telling stories, sharing information. Libraries. It's amazing how creative people have gotten with all the things that they've developed online. Museums, online, doing their tours where you can see a lot of stuff without having to travel and do with the crowds. And it'll be interesting to see how many of these things continue as we are starting to see rates of infection or hospitalizations, at least increases in vaccinations. It'll be interesting to see how what of those things we continue over time. But we are kind of at a point where there's sort of a light at the end of the tunnel, which is exciting, but it's also a little scary sometimes. There was for a long time they talked about Fomo, fear of missing out, and I just saw FOGO the other day, which is fear of going out. We spent the last year really hunkering down and protecting ourselves and our loved ones, and now we're in the point where we're trying to figure out how to deal with it when it moves on to the next phase of this. So I suggest, both, figure out dipping your toe in and trusting your gut. You will have to decide for yourself what you're comfortable with, who you're comfortable doing things with. Are you more comfortable small groups outdoors, and everybody wearing their masks? But ultimately getting information from your providers about your specific needs and abilities, and things that you need to take into account. Department of Public Health, CDC, their recommendations, where you balance everything and figure out what makes the most sense for you. And that is the end. And I know we're coming up on time, I'm sure. So if there are questions or comments, I'm happy to take those. This is also my contact information if you have questions or thoughts later, feel free to reach out and I'll look at the chat also.
Thank you so much, Lara. So much information that we need to know, especially these days, as you said. There is one question in the chat, and the question is, should the word be physical distancing? We really don't want to distance ourselves socially. Celia Christian asked that question. Should the word be physical distancing? We don't want to distance ourselves socially.
Social distancing is what has been very beneficial from a physical perspective in this last year, but we need each other. And both from the pandemic that we've been dealing with, general dealing with chronic illnesses, and a lot of chaos that goes on in our world in general. So I definitely am a fan of being physically distanced when it's the safest thing, but finding ways to be emotionally and socially connected.
Thank you very much.